Hi, this is Jinyuan. My presentation is about anger mismanagement in athletes from a sports psychologist perspective. This presentation is going to firstly introduce the topic of anger in athletes from a sports psychologist perspective, then explain the causes of anger and anger mismanagement, beneficial and negative influences of different anger management strategies will be explained. Finally, behavioral and cognitive interventions will be introduced to manage anger and optimize performance. Anger is an important topic because it is one of the 6 universal emotions as listed at the right that could be experienced by all humans regardless of culture and age. Anger is an emotional state typified by feelings varying in intensity from mild annoyance to rage, with corresponding changes of arousal in the autonomic nervous system such as increased heart rate and blood pressure. This presentation is going to focus on anger in adversary sports, that is, angry athletes in adversary games, such as football games. This population is interesting to look at because anger is their most frequently experienced emotional state. This is because of the nature of adversary sport and anger, which will be explained by this diagram. Anger can be experienced when highly desired goals are blocked. In the context of sports, that is to win the championship or achieve the best performance. When this goal is interfered, this is experienced as an aversive stimuli, so athletes may feel frustrated or interpret opponents' actions as a provocation. Then anger, as a stress response, is experienced and the relative physiological arousal are activated. If it is not managed properly, anger can be expressed verbally or even physically or suppressed depending on different circumstances. As anger starts with blocked goals, then the question is how they are blocked. It could be blocked by different groups of people. During training and games, the player could be angry of themselves because they think they should or could have done better. This means their own unsatisfactory performance prevents them from the championship. This inward anger may lead to increased anxiety, depression, and worsen in performance. Other major part in adversary sports is the opponents, who they compete for the only championship. Therefore, the player's desire for victory will be naturally blocked by the opponents. Due to this nature, the presentation of anger as verbal and physical conflicts is often seen among opponents. Sometimes teammates could interfere with obtaining the goal, for example, when their performance does not meet the expectation or the required standard, then one may feel angry by thinking, why can't they take it seriously? However, they may choose to suppress the anger for the sake of overall team dynamics. These are 3 major parties involved in adversary sports, where every involved members could cause anger as they could all block the goals of winning the game. And this is the reason why anger is the most experienced emotion in sports. The influence of being angry on athletes is interesting because if anger management is practiced properly, anger is not perceived as detrimental as in other domains. In fact, research shows 75% of athletes perceive anger as facilitative to accomplish tasks. With higher physiological arousal, that is, the better activation of the body, angry athletes could manage anger as an instrumental strategy to direct energy, sustain effort, increase alertness, to be more motivated, confident, and have more powerful skill execution, then achieve the goal more effectively. However, anger could be dysfunctional when it is mismanaged, when anger leads to diverted focus from the task to the offender for retaliation. In this case, a aroused body is used for conflicts or even violence, but not the task. It resulting wasted energy and effort, decreased alertness to the current performance. If they choose to direct anger inwardly, there will be decreased mood, motivation, and confidence. Anyway, the overall skill execution and goal achievement is worsened due to anger mismanagement. Therefore, it is important for athletes to manage anger both physiologically and cognitively with appropriate coping strategies so that anger could actually become facilitated. Athletes who struggle with anger mismanagement could be helped by sports psychologists. Sports psychologist is a profession that optimizes athletes' performance and well-being using empirical evidence from psychology research. There are many effective interventions as listed, targeting both behavioral and cognitive part of anger. Depending on different situations and research, sports psychologists could design the duration of interventions as long-term or brief, the format of interventions as individual or group, and the setting as in clinic or training space. To manage physiological aspects of anger, relaxation therapy will be explained in detail. It could be applied during the game when athlete's body is too aroused because of the anger. In this case, fast adjustment is required for limiting the dysfunctional effects of anger, and self-practice of relaxation therapy as a form of behavioral therapy is found to be the most effective approach to manage current state of anger with large effect size of 1.2. The intervention of relaxation therapy aims to adjust the physiological aspects of anger, for example, using breathing techniques and imaginary muscle relaxation to manage body arousal. This intervention involves teaching athletes the techniques and train them for effective practice. To optimize the effectiveness, relaxation therapy could be delivered in brief group sessions before every training, so they can gradually familiarize themselves with practicing the techniques. Then they are expected to apply the learned techniques when they feel angry and too aroused during the game, when their goals are blocked by themselves, opponents, and all teammates. To manage cognitive aspects of anger, cognitive restructuring will be explained in detail. Unlike during the games, athletes have longer time before and after the game to experience and process anger. As explained previously, if they perceive anger as dysfunctional, there will be detrimental effect on the performance and well-being. To target this cognitive process, cognitive restructuring as one kind of cognitive therapy is evident to be effective with large effect size of 0.83. It aims to promote positive attitude and interpretation toward anger to optimize their performance. This is approached by exploring and challenging individuals' negative thoughts and beliefs in relation to anger and replacing it with positive appraisal and coping cognitions as explained previously. Using cognitive therapy techniques, the intervention is suggested to be individualized as different athletes may have different cognitive approaches to anger. 8 sessions is found to be effective enough without demanding too much commitment. To respect the privacy, these interventions should be carried in formal and private settings, such as clinics. After interventions, they are expected to find their own positive ways to appraise anger and to use anger to facilitate performance. They could practice the learned cognitive approach before and after the game when anger is caused by themselves, opponents, and all teammates. And when they fully endorse the facilitative appraisal style, their anger could be managed regardless of time points. In summary, athletes in adversary sports could actually take advantage of the fact that they feel angry all the time and manage anger to facilitate their performance. This could be achieved with the help of sports psychologists by having cognitive and behavioral interventions to targeting different time points of the game. And that's all for my presentation. This is my reference list. Thank you for listening.